manually connect all those dots across, say, a decade of data, that's next to impossible for a human to do on the fly. It's a narrative, a really complex one. And the challenge is teaching a computer how to read it.
And that leads to the big what if, right? What if an AI could actually read this entire messy story and maybe even help write the next chapter? So this is the puzzle researchers are trying to solve. Can they build an AI that goes beyond just understanding, normal human language scraped from the internet and instead learns to speak the unique, incredibly complex language of healthcare? And that brings us to our next section, a new language model. This is where we meet COMET. It's a new kind of AI called a medical event foundation model. It was developed by researchers over at Epic and Microsoft, and it was trained on an absolutely massive, de-identified dataset called Epic Cosmos. So let's dig into the methodology.
Okay, before we go any further, let's just make sure we're on the same page with this term foundation model. Think of it like this. Instead of teaching an AI to do one very, very specific thing, you train it on a mountain of data so it learns the fundamental rules of a whole subject. It's like learning all the basics of physics before you decide to specialize. You build this incredibly broad, strong base of knowledge first, and then you can apply it to all sorts of different problems.
Now, this right here is the absolute key to understanding what makes COMET so different. On the one hand, you have your typical language models, right? They've read the entire internet, Reddit threads and all, to get really good at predicting the next word in a sentence. But COMET, it's playing a completely different game. It learns to predict the next medical event in your health timeline. The words it's learning are diagnoses, lab results, and medications, all pulled from millions of real anonymous patient stories.
And when we talk about the scale here, just look at this number, 115 billion with a B. That is how many individual medical events this model was trained on, all pulled from over 118 million patient records. I mean, it's just a mind-boggling amount of data. And that is exactly why it's